oversized facial tumor renders a 30-year-old man in a remote area in Dong Thap, Mekong Delta province, unrecognizable as a human being, as it covered his entire right ear and disfigured part of his mouth. Hope for surgery first sprang up in 2005 when a teacher in Ho Chi Minh City recognized his pain and kept knocking on doors at major hospitals in the city to find ways to help him.
In 2005, when I went to Ho Chi Minh City-based oncology hospital for a medical examination, I met Hoang Em and his mother there by chance. The mother told me that the tumor on her son's face did not stop growing while the family was very poor. The hospital refused to treat the case because the tumor was too large and the surgery's fees were way beyond the financial ability. I contacted Dr. Lu Ba at Ray Hospital in Ho Chi Minh City, and he agreed to view the case. He and his colleagues held a consultation and agreed to perform a surgery to remove the tumor.
When Lê Hoang Em was born in a remote area in the Mekong Delta's Dong Thap province 30 years ago, a small tumor that looked like a birthmark appeared on his right cheek. At the age of 1, his parents brought him to the oncology hospital in Ho Chi Minh City, where he was treated with radiotherapy, but doctors failed to diagnose his condition. Since then, the tumor has grown uncontrollably. In May 2005, Hoang Em was admitted to Cho Ray Hospital for surgery. Dr. Dong Lu Ba diagnosed him with hemangioma, an abnormal buildup of blood vessels in the skin or internal organs, and agreed to perform the surgery.
However, in 2011, his mother told me over the phone that Em suffered from excessive bleeding from the tumor. So I asked the family to bring him to Ho Chi Minh City for more examinations.
Tôi với em ăn chúng cơm sớm 2, ăn ngày có 2 chén, 8 giờ ngủ rồi, 7 giờ hết rồi. Kêu bạn mấy bạn có bằng ruộng đó, nó tới cắt lúa kêu khoai lúa.
Những ngày mà không đi làm ở nhà em làm cái gì?
Cũng như dần nhà không lại sớm được chơi, không đi đâu. Nói chảy chịu chạy tiếng hồ là ngừng trên cơ thể mà hết má là ngừng.
Ở lúc đó có bị say sẩm không?
Thì chấn ngập. Trời đất chấn ngập, mở mắt ra thấy chấn ngập. Không, tôi đi chơi bạn cũng quen nó không ấy, cũng bình thường.
Rồi những đứa nhỏ hàng xóm khác thì sao?
Nó cũng hơi sợ. Ở đó cha mẹ gì ở trên là đăng ký mổ luôn.
Mà khi lên bằng mổ lúc đó em có sợ không?
Không, nghĩ mà hết bệnh. Không có cơ hội mổ rồi cho con hết bệnh.
When he was in the operating room at Ray Hospital in 2005, I and my husband stood outside, full of fear, because we didn't know whether or not he could survive the operation. We were so happy as soon as we heard he stayed alive.
In spite of the deformed face, Em says he is not the subject of scorn from those around him, except from some children.
Tôi thấy cái hoàn cảnh của Hoang Em nó bệnh tật tôi cũng rất thương.
His condition is so pitiful. I often hire him to take out my rice grains and dry them in the sunlight. One day, I saw heavy bleeding from his tumor when he went ashore from the river. I'm very frightened and quickly cut my hand around the wound. But the bleeding did not stop. While the bleeding lasted, he laid motionless, so I thought he had gone. Afterwards, I shouted for help to those around. We had no choice but waited until his bleeding stopped. His blood is so sticky that no woman dares take a meal after smelling it. Hoang Em's family has good relationships with their neighbors. However, some children, including my 2 granddaughters, often scream in terror when seeing his deformed face.
Besides having no real appetite, Em could only sleep lying on his left side.
He has been carrying the tumor since he was born. He is a good-natured person who never runs foul with anybody. I was very happy when I heard Hoàng Em was operated on in 2005, but after that, as the tumor grew larger, I worried a lot. I hope he would have the tumor removed so that he can support his parents and start a family.
Sam Ottawa, who runs a virtual medical miracle network based in Canada, has referred the case to American plastic surgeon McKay McKinnon, who recently performed 3 major surgeries to save local tumor patients Wen Yi Hai, Tak Thi Sali, and QT Mei Yung. There's hope for his surgery because Dr. McKinnon has agreed to consider the case, Sam said.